Welcome back, everyone. Did you know heart disease is the leading cause of death in the U.S. for both men and women? It's a scary statistic to think about, but there are plenty of simple things you can do to help protect your heart.
Absolutely, and here to show us how and to give us the symptom signs on, well, if you need help, cardiologist Dr. Stephen Portz with HealthCare Partners Medical Group. Thank you for joining us.
Thank you for having us. It's a pleasure.
All right, so people might not be able to understand it unless it's spelled out right in front of us. What exactly is heart disease?
Well, there's a lot of different kinds of heart disease. The one we are most familiar with would be that causes heart attacks. It's really a vascular disease, and that involves the whole body, not just the heart. But once it involves the heart and can cause damage to the heart, then you've got actual heart disease. But there are many other kinds of heart diseases too.
Does it usually take time to manifest itself, or is it just sudden and then you have it?
It's both. This disease begins in our teenage years, and it depends on what kind of lifestyle we have, our genetics, diet, exercise, how fast it progresses. Many times we have people who don't have really significant blockages that can rupture and suddenly cause a heart attack, and they never had a symptom before. Yeah. And there are others that develop chronic steady pain.
So at what point should we visit a cardiologist then?
Well, anytime you have symptoms manifested of exertional type chest discomfort, a lot of fatigue, and not feeling right, your physician may pick up signs or symptoms that may refer you to a cardiologist, or you can request to see a cardiologist.
And right now we have some heart attack signs here that start with chest pain. That's the easiest way to kind of know that there's something's wrong with you.
And many times patients are expecting horrible pain, and many times the pain is, when I tell them that's the heart, it's like, you're kidding me, I would have not thought that's my heart attack, because it's not that bad. There's frequently sweating, short of breath, the discomfort. And those are signs and symptoms. Even if it's not a heart attack, you got to go get checked out and make sure right away, because it's important we get you immediately if there's a heart attack going on.
Do you see that a lot of guys put off going to the doctor? They're busy, they make excuses, they don't want to come in.
They're too
Their
tough.
family member has to drag them in.
Sounds like me.
There you go, a classic example.
No, it is. It's hard in our busy schedules to do that, but when you are feeling poor, preventative medicine checkups are very, very important to avert not only cardiac disease, but many diseases.
I think a lot of guys might shy away from doing the checkup because they don't want to hear negative news, but it's a lot better than going in with really negative news.
It's better to find negative news real early than it is when it's too late.
So what are the options? Is surgery an option?
Surgery is an option we like to avoid. I would much rather have a patient treated early on to actually prevent disease. And if they are found to have disease, then do everything we can do to prevent the progression of disease, to slow it down, prevent bad outcomes or bad events from happening in the future.
Yeah, let's talk about prevention again, and for people who are listening, can you give us some tips and some steps we can take right now to help our heart?
No better time than right now. Start with proper diet. There's plenty of information out there about diet. Don't smoke. Las Vegas, we have so many smokers here, so I treat so much heart disease, vascular disease of the legs, carotid disease. A lot of that smoking related. Exercise is so important, probably one of the most important things that you can do.
And you don't have to be pumping iron, you just a walk around the neighborhood.
Exercise. You play golf, get out and walk, not just ride in the cart, or get a formal type of exercise. It's easy to do.
Ideally, how much exercise should we be getting either per day or per week?
I would like to see everybody 45 to 60 minutes, 4 to 6 days a week.
4 to 6 days a week.
And that can be involved both aerobic type work and some strength training.
When we're doing these things, will this reverse the possibility of blood pressure or kind of freeze it? I mean, will these good habits help us reverse the signs of heart disease or no?
You can. We can, with proper medical therapy, exercise, weight loss, not smoking, slow it down, and sometimes even see regression of disease, plaque.
And we're talking about for guys here, but for the ladies, we also have heart attacks. It's not really talked about. But what are the signs and symptoms for women as compared to men?
Men tend to have more classic symptoms that we would read about in a textbook of the pressure and the tightness and the squeezing and the shortness of breath. And women, you just have to be able to pick up any kind of symptom. Anytime their symptoms are more subtle or they're not as classic, and you can have discomfort from the heart in the jaw, the shoulder, the hands. It's not always in the chest.
Yeah. We have about 30 seconds left. I hear that there's always a good cholesterol and there's a bad cholesterol. What's the difference?
Well, the bad cholesterol is LDL cholesterol, L for lousy. And it's a cholesterol that actually causes inflammation in the plaque, in the arteries, and creates the damage. The HDL is the good cholesterol, the happy one. And it is a smaller particle. It goes in, it can actually help remove plaque, reduce the inflammation, the risk of rupture, and that's what we adjust with our medications, those ratios.
What can you find good cholesterol in?
Well, you don't eat good cholesterol or eat bad cholesterol. Most of the cholesterol we have in our bloodstream we make by eating saturated fats.
Gotcha. All right, doctor, some great tips. Again, go see your doctor, get regular checkups so that you know what's going on with your body and your health.
That's right. Exercise, good diet, see your physician.
Great. Thank you.
Thank you.
If you have any questions, our pleasure, for Dr. Portz, or would like to see him, his office is on West Sunset Boulevard. For more information, call the number or go to keepmydoctornv.com.